Hello, everyone. Welcome to JA Explained. This episode is all about medical transitions and how you, as a parent or caregiver, can help prepare your child today so that they can better manage their care as young adults. My name is Jennifer Burke, and I am from New York State. I'm a wife, I'm a mother of three. My youngest is a senior in high school and was diagnosed at the age of 10 with juvenile arthritis. It's really important to me to set kids up to be able to manage things on their own. One of the neat things that we did was go to the 2023 Arthritis Foundation Family Summit, and that happened in Atlanta, Georgia. And at this location, had the amazing pleasure of meeting Dr. John Bridges. And Dr. John Bridges is a combined adult and pediatric rheumatologist at the University of Alabama in Birmingham. And his clinic and research interests include improving outcomes related to pediatric rheumatology care as patients transition into adulthood. Now, Dr. Bridges is also the founder and director of the Bridge to Adult Care from Childhood to Young Adults with Rheumatic Disease, the BACC YARD program. And that's a pediatric to adult rheumatology transition program. And this provides resources that enhance the care and improve quality of life for teens and young adults living with juvenile arthritis. So, Dr. Bridges, I want to thank you so much for joining us and welcome to the conversation.
Yeah, thanks for having me. It's good to see you again, Jennifer.
So, I'm guessing like a lot of us understand what it's like to be at a pediatric rheumatology, but can you kind of like explain the differences in treatment approaches between pediatric and adult rheumatology care and like how it kind of impacts the child's condition? And also, like, how do we find that qualified adult rheumatologist who really specializes in treating people who were diagnosed at a young age?
Yeah, so that the second part of your question is tough, right? You can Google a lot of things about a doctor's office, but it's very rare that they mention much at all about adults with pediatric onset illnesses. So I think your best source of advice is probably talking to your child's pediatric rheumatology team and asking, where have you sent patients before? Who do you have a good interaction with? Who do you feel like you have open lines of communication with? Because that handoff process can really make a big difference. If you feel like the doc that knows your son or daughter really well, being able to communicate clearly with their adult rheumatologist, that is worth its weight in gold sometimes. But in general, adult care is a lot different than pediatric care. There's not as much focus on growth and development because that's all already happened. So it's more maintenance of well-being and screening for issues that might crop up as a person ages. And the instead of having a family-centered, kind of a triad or a dyad, depending on your family situation, people that between the patient, the parents, and anybody else that's involved with the treatment team, all of a sudden in the adult world, it's the patient is front and center, and it can kind of feel lonely and a little bit harder to make decisions in some ways. So that's a big change. And then there are some changes in how often you might see your patients, just depending on how stable a disease is and how much support as far as ancillary services that are involved in the clinic looks a little bit different from the adult world compared to the pediatric world too.
Okay. So what can we expect during that like initial appointment with an adult rheumatology? Like, are there certain documents or medical records, or what should we bring, or how should we approach that first appointment?
Yeah, so that's a nerve-wracking appointment for sure, and sometimes it takes a while to get in. So some adult rheumatology offices are out 9 or 12 months for your next appointment. So it's good to think about making that appointment early and maybe still having an appointment with your pediatric rheumatologist on the books in the meantime to make sure things go smoothly. It's not a bad idea to ask for paper records to take with you to the visit. In a perfect world, the adult rheumatologist has a stack of your records. In an even more perfect world, the adult rheumatologist has talked with your pediatric rheumatologist about your son or daughter. But sometimes the adult rheumatologist walks in the door and just knows that you're a new patient, and that's all. And so if that's the case, then if you have some patient paper records that you can go through with him or her right there in the appointment, that helps smooth over that initial like, oh gosh, just send me back to pediatric rheumatology feeling that you might get. But I imagine a lot of the first appointment is just getting to know each other and making sure that everybody in the room, both the patient and the new provider, have a good understanding of the medical history that brought you there, how things are currently.
I'm curious, like, how do we ensure then to have effective communication and collaboration between the pediatric and the adult rheumatology teams during this whole transition process?
Yeah, so I think that comes back to getting a good recommendation from your pediatric rheumatologist, who you should see as an adult rheumatologist. Hopefully, it's someone that they have a pre-existing relationship with, and that they can have an open line of communication to kind of do the handoff and then answer any questions that might come up after that first visit. So that's and you know how, as far as can the patient and their family control that? Not quite as much, but maybe when you go to your pediatric rheumatologist and you say, "Hey, I'm going to be moving to this city for college and or for trade school or whatnot, and I'm going to find a rheumatologist there. Do you have any recommendations?" When your pediatric rheumatologist runs down the list and might mention like, "Oh, well, I've sent other patients to this doc before and talked with them," like that may be your golden ticket for, oh, there's a open line of communication between those folks. Not that you can't have a pediatric rheumatologist and adult rheumatologist speak when they don't know each other before, but there's proof in the pudding of if they've had success with it in the
Sure.
past.
Sure. Yeah, that's something we're currently going through with our pediatric rheumatologist because our daughter's talking, about going to college out of state. So we're kind of in that limbo of we're not exactly sure where she's headed, and so we're looking at different hospitals and doctors and taking that step now so that next year when she does go, we'll be in a better spot. So we've talked about how that communication happens. I'm wondering, do you know of any like resources or support groups that are available to help your child cope with the emotional and like just the different aspects of the transition? There's so much that goes into it.
Yeah, there's certainly a lot of potential for anxiety around this, and some patients have been seeing their pediatric rheumatologist for a decade or more, right? And so it's a big switch in a stressful time of life when there's a lot of other changes going on, and so it's talking to other patients through things like the Arthritis Foundation and talking to other families can definitely help troubleshoot some things, which can help ease some anxiety and just commiserate a little bit. They're like, hey, the adult waiting room just isn't nearly as friendly. There aren't as many colorful pictures or whatnot. So I would definitely lean on your program's friends that you have through programming through the Arthritis Foundation. So.
Okay. So how often should a young adult like expect to see their new adult rheumatologist?
The most likely answer to that is about the same frequency that they were seeing their pediatric rheumatologist. So those decisions are based on whatever disease brings you to see a rheumatologist, how frequently monitoring needs to be done, how frequently you need labs, depending on what medicines you're taking. So if you were seeing your pediatric rheumatologist every 3 to 4 months, you'll probably see your adult rheumatologist about the same. But if you're every 6 months or once a year, you may see your adult rheumatologist a little bit more frequently at first while they're still kind of getting to know you. But it will probably be pretty similar. And that's something to keep in mind if you're facing the issue that Jennifer, you and Liliana are thinking through of, are we going out of state? Or, is my child going to be coming back home every break? Like, do I want an adult rheumatologist close to me or close to whatever school or place they're going to be? So trying to predict the frequency of adult visits based on frequency of your pediatric visits can sometimes help to say, well, do these logistics even make sense? So.
Sure. I think what we have to do is get her to look at a college near you.
Yeah, we've got
That'll make
UAB,
my
we've got
life much easier.
Stanford, we've got University of Alabama, all sorts of them.
So are there any like specific questions or concerns that you recommend being discussed with an adult rheumatologist during the first appointment?
So I think the big picture that you want to accomplish during the first appointment with adult rheumatology is just making sure that everyone has the same understanding of your disease history and what your current status is, like what medicines you need. That's really at the end of the day the most important thing. You want to keep a good thing going from that transition. So that is really the meat and potatoes of what needs to happen. Now, to switch food groups, the icing on the cake, there's some other things that I personally like to talk about in my patients, make sure is discussed when they're first adults, and that's some more adult-oriented things. So I like to ask patients about if they've ever thought about becoming pregnant, if they're doing things that could get them pregnant, if they're doing other kind of sex, drugs, and rock and roll type things that maybe a pediatric rheumatologist isn't as focused on, but in the adult world, it's important. It interacts with a lot of our medicines. And so that it's kind of an artificial time of that switch to say like, oh, hey, while we're talking about all this adult stuff, let's just go run down this list and make sure we have a good understanding of what the ramifications of these medicines of this disease are. And so that everybody's on the same page, and it kind of opens up hopefully a comfort level so that patients, if things about those questions change as they're going forward, it's easy to talk to your adult rheumatologist about it because they've already asked the awkward question the first time. And that may be a different field than pediatric rheumatology was, just depending on where you are. A lot of pediatric rheumatologists are harp on that stuff all the time, but it just is provider specific. So
Perfect. So Dr. Bridges, I just want to thank you so much for being here today and for the incredible conversation. But I'm curious, do you have any last like takeaways or things that you might like to share that would help children make the switch?
yeah, so this is it's kind of weird being a physician that makes recommendations about transition, because a lot of this is like parenting style and kind of coaching. So I think the thing that helps patients and families the most is thinking about this early, and families finding other families that have similar parenting styles to them so that they can pick up on some clues and some like, oh, that's what I'm going to try next, and kind of build from there. Because it's if you've got a totally different parenting style than somebody else, then trying to model your path to help your child transition on theirs isn't really going to fit. So the the opportunity to network and to talk with other families really is invaluable for stuff like this. To find families that you kind of mesh with and can say, oh, they're just a couple steps ahead of us, let's see how they succeeded, and try to model that, since we have some other similar parenting background type things.
Awesome. Well, before we sign off today, I do want to remind parents that the Arthritis Foundation has several resources that can help you better manage your child's arthritis. This includes the Live Yes Connect group, which meets in person or online. And in these support groups, you will actually meet other families and parents who really do get it. They understand what you're going through. And together with the help of experts, you'll kind of learn new ways to help your child and to help yourself and have everybody cope better. The foundation also hosts webinars, podcasts. They have several toolkits that can help you care for your child with JA. You can go to arthritis.org/JA for more information. And I want to thank you so much again. I want to thank the Arthritis Foundation for hosting episodes like this that I know from a parent perspective changes everything. And to Dr. Bridges for sharing his expertise.